Okay, today's date is June 13, 2015, and this is my threaded discussion for week 2. Okay. The first thing I'm supposed to define is ethics. Okay. Now, ethics is, out of the book, ethics means the core values that define one's relationship with others. So, what does that really mean? Well, in the medical field, ethics are very, very important to patient care. We need ethics. Why do we need them? Because ethics are, well, they're like our code. It's what we follow. It's what tells us what's right and what's wrong. And it does it in a logical way. It's not about what we think. Well, we may say, hey, I don't want to do this, or is this right? And we have to fall back on our ethics, our code. Now, I have experience in the medical field outside of school and the Surge Tech program. I was in the military for 6 years. I was a medic, and we, as a medic, we were taught about ethics. One of the earliest things I remember, like my first day, number one thing that a medic should remember is do no further harm. We're there to help our patients. We're not there to hurt them. We're not there to cause any other injuries. So every action we take, every decision that is made is supposed to benefit that patient, not harm them. And some people at times forget that. They might be in a hurry to make a decision, or they might have fears or disagreements about some of the interventions that they're doing, and at the end of the day, it doesn't help the patient. It only hurts them. And as medics, that's a big, big, big no-no. Now, and during that time, even now, I've learned that no matter what field you're in, it's interesting that we're going over ethics because, like I said, I was a medic. We went over this all the time. What's the right thing to do? Even if you can do something, should you do it? It's always a question. These questions will always come up, which is why they still teach it today. And going over it now, I've seen that no matter what field you're in, whether you're a doctor or a surge tech, whether you're a nurse working on the floor or as a circulator, everyone should have a code of ethics that they follow. It's very important that they have a code because when these issues come up, what do? You know, what decisions should you make to help the patient? Their actions should always benefit the patient. That's very, very important. And you may be saying, "Oh, well, that I know that. That's easy. It's simple." But there is actually a difference between ethics and morals. And a good example, I actually heard an example one time. Say a man, he's married. A man who's married has a wife. An ethical man would know that cheating on his wife is wrong. But a moral man would actually feel bad about it. So that's the difference. Morals are tied more into what we feel, our thoughts, our opinions, our bias. You know, it's more towards the emotional. It goes closer to our personal belief system. Ethics are more logical, I think. So a good example would be, say you're in a situation where you disagree with what's going on. you morally might not like what's happening. You don't like morally have you have qualms about a decision that a surgeon makes, or a patient comes in and wants to have plastic surgery done to change their gender, or get like a breast implants or plastic surgery done, and you morally have are against it. You do not believe in the procedure, or you don't agree with the surgeon because of personal feelings. Well, that's not what ethics are about. Ethics, at the end of the day, are about doing what's necessary for the patient, not what's necessary for you and your belief system. And this concept, you may be saying, "Oh, well, this concept is it's really easy to grasp." But if you look closer at some of the bigger issues that have been going on, and will most likely continue to be controversial, it's not always that simple. It's, "Oh, well, this is right, this is wrong." I mean, a good example of that would be something like abortion. If you were to go into a room right now, and ask people their opinions on abortion, right away, you'd have people on the fence. Some people might be for it, some people might be against it. Or, once again, with ethics and morals, some people morally may be against abortion, but on an ethically, they may think, "Well, I don't believe that people should have abortions, but I don't think it's right to force people to give birth." And there will be a number of people who have different opinions. But at the end of the day, if you're ever scrubbed in on this kind of case, say for example you have a patient who comes in, and this is like her third or fourth abortion, you remember her, because for the last couple of years she keeps coming in, and this is her fourth abortion, and this is the fourth time you've had to do it, and you absolutely are against it. You might even be uncomfortable or sickened by this case, but you're responsible. You have to scrub the case. That doesn't mean you have an ethical responsibility to do the best you can to make sure that this case is successful, that nothing goes wrong, that everything goes right, and that at the end of the day this patient is healthy and will recover. It's not your job to say, "Oh, well, this patient, she shouldn't be getting an abortion, so I'm not going to give forth my best effort." That's wrong. That is ethically wrong.